Hey, good morning. This is Warren Alston with you again from Trust Owens, Stokes Farnham. So what we're doing today is we're going to revisit a video we did. Actually, this is going to be a replacement video for Medicare Monday, where we're comparing Medicare supplements and Medicare Advantage plans to see what the maximum out-of-pocket exposure is. MOOP, maximum out-of-pocket. That's what we're going to talk about today. So when we get started here this morning, first thing we're going to do is we're going to talk about something that everyone has to pay, whether you're on a Medicare supplement or whether you're on a Medicare Advantage plan. I've got it right here on this nice whiteboard that covers the Part B premium, okay? So Part B premium for everyone, and this is for 2024, and this does not include IRMA if you are a high wage earner. This is $174.80, okay? That's what everyone is going to pay for their Part B premium, unless you're a high wage earner. $174.80 times 12 months is $2,097.60. So from here forward, we'll just call it $2,097. So whether you're on a Medicare Advantage plan, Medicare supplement, you're paying that Part B premium. That's what it is. $174.80 for 2024. Changes every year. That's what it is for the upcoming 2024 year. Now, we're going to take the route of Medicare supplements first. In the previous video, I just had a example of a 65-year-old female. Those are almost always going to be among the very lowest premiums that are available. Someone that's just starting Medicare at age 65, female, is going to pay the lowest premiums. Those are going to be just a rough average around $120. Okay, it could be a little less, a little more. We're going to call it about $120 for a 65-year-old female. We're in the state of South Carolina, in the upstate of South Carolina. So, these Medicare supplement premiums go by zip codes, basically. For some states, some other states that have statewide premiums, but for this purpose in South Carolina, that's a good average, $120 for a 65-year-old female. On the opposite side is going to be an 80-year-old male. So, as you're getting older, this is health insurance. So the older you are, these are attained age premiums. So an 80-year-old male is going to pay probably close to half or a little more than, or not half, but twice as much as what a 65-year-old female will pay. Okay, so we're going to say that's going to be about $250 a month for an 80-year-old male. On average, both of these are Plan G. Okay, so here's what we have: the Medicare supplements, the 65-year-old female, and the 80-year-old male. And I've got the numbers here that go over the details. Okay, and I'll say them for you. So the 65-year-old female, 120 times 12 is about $1,440 annually for her Plan G premiums. $1,440 annually. Also, the 80-year-old male, 250 times 12 is $3,000. That's what he's paying annually for his Plan G premiums. The only out-of-pocket exposure you have within the plan itself with Plan G premiums is the Part B deductible. That's $240 for 2024. So the premiums plus the deductible is the total out-of-pocket just inside the plan. Okay, so when we add everything together on the female and on the male, we're looking at $37.77 here for the 65-year-old female. And what is that? $53.37 for the 80-year-old male. So that's a pretty good difference. That's some $1,550 or some odd change between a 65-year-old female and an 80-year-old male. But that's what it is. That's including the Part B premium, which is $2,097.60. And for the 65-year-old female, the annual premium of $1,440 plus the 240 Part B, and the male, 80-year-old male, $3,000 annual premium plus the 240 Part B deductible. So $3,777 for the female, $5,337 for the male. So as you get older, these Medicare supplements cost more. And remember, Medicare supplements are health insurance. So as you get older, every year, you're going to have increases because you've gotten a year older, and also because of across the board increases that each insurance company will have annually. Okay, so now we move on to Medicare Advantage plans. We know with Medicare Advantage plans, you still have to pay the Part B premium, as I said earlier, $2,097 for 2024. Okay, you also have average maximum out of pocket within each Medicare Advantage plan, and that is different with each plan. So this is what we know with Medicare Advantage plans. Most of the monthly premiums with Medicare Advantage plans are zero. However, there are some Medicare Advantage plans that have premiums. They're usually small, $19, $29, $39. There might even be some that are in the $40 to $50 range for a Medicare Advantage plan premium. But the majority of them are going to be zero per month cost. And in our examples that we're running today, we're going to assume that these plans we're talking about have a zero monthly premium, no monthly premium to go with them. So it's simple to come up with this. For the maximum out of pocket with the lowest plan I know of for 2024 is $3,450. This is maximum out of pocket for a Medicare Advantage plan, and $3,450. So no matter what happens to you with this Advantage plan, how much you go to the doctor or hospital, once you hit $3,450, then you've paid your max on that particular plan. There are a lot of other plans that have much higher maximum out-of-pocket cost. Some even go up to $10,000 and more, according on whether you're in network or out of network. But I think if you average it all together, it would be fair to say that maybe $7,000 would be a average maximum out-of-pocket exposure for the average Advantage plan out there. So $2,097 for the Part B premium, and the maximum out-of-pocket cost average of $7 leaves $9,097 for a Medicare Advantage plan. Okay, $9,097 of exposure. Okay, for a maximum out-of-pocket. So it's going to be different because this $9,097, okay, this Advantage plan, there are no price differences according to age like there are with Medicare supplements. So with a Medicare Advantage plan, whether you're a 65-year-old female or an 80-year-old male, on the average plan, you're going to have a zero per month premium. It doesn't matter how old you are. That's just what it is, zero per month premium. So much different when you make this analysis, because it doesn't matter how old you are with the Advantage plan. It very much matters how much you are with the Medicare supplements. Okay, so that gives you a good overall view of the difference in max out-of-pocket cost for Medicare Supplement Plan G and Medicare Advantage plans side by side. Okay, so one thing to keep in mind, this does not include Medicare Part D prescription drug plans. That will add to your cost. If you're on drugs, you're going to have costs for the plan on a Medicare supplement. In the early days of Medicare supplements, they could have Medicare Part D prescription drug plans rolled into them. Now, Medicare Part D prescription drug plans are not allowed to be in Medicare supplements, and they're not in any Plan G that you could buy or any other modern Medicare supplement you could buy. Okay, so Medicare Part D prescription drug plans are separate and apart, and that is an additional cost that is going to be dependent on what kind of drugs you're taking, generics, name brands, and what plan you're in. Okay, there's a separate Medicare Monday that we have on Part D prescription drug plans. You can watch and learn a lot more about how the cost with Part D prescription drug plans can be formulated. But anyway, know that in this example, Medicare Part D prescription drug plans are not a part of these equations. However, with Medicare Advantage plans, and we've had this in previous Medicare Mondays, Medicare Advantage plans, most of them, not all of them, but most of them have prescription drug plans included in them. Okay, so that is a part of your total cost. So these things are hard to navigate through. I mean, you're saying, well, this one has the drug plan included in it. This one doesn't have the drug plan included in it. And so, it's really hard unless you have specific drug lists that you're looking at to get in there and figure out which one is the best cost-wise for you. There are also differences in Medicare supplements and Medicare Advantage plans that we won't go too far into, but Medicare supplements in general, most of them, you can go to any doctor you want anywhere in the country. All they have to do is take Medicare. Same way with hospitals. With Advantage plans, there could be more restrictions. You may not be able to go out of state except in cases of emergency. If it's an HMO, I mean, there's just a lot more restrictions that we've gone into on other videos that we won't go into here. So this is just a broad snapshot of taking a look at some of the differences that these different plans are going to have for your checkbook throughout the year, and maybe it'll help you make your decision. If you have questions for us, you can go to our website, trustowens.com, stokesfarnham.com. I'm Warren Alston. You can contact us through the website. If you have any questions or anything, we're here to help. I'm happy to do anything I can to assist. Hit our websites. Don't forget to subscribe and hit the notification bell and the like button if you like everything that's going on here. We so much appreciate you watching our videos. And remember, at Trust Owens Stokes Farnham, we're here for you. Thanks.